My husband, Dr. Donovan Christie, is going to give you guys a talk today on Andropause. And he is an anti-aging integrative medicine specialist. And he's been in practice for over 20 years, so he's a wealth of information. So you guys tune in and listen up for a treat. You're in for a treat today, okay?
All right, thank you.
Hey, it's good to be with the men and a couple of the ladies here. It really is. This talk is one of my favorite talks to give because as you get older, certain things happen in your body, and it's important to understand how we can do things to make sure that we maintain our vigor. Now, everyone here has heard of the diagnosis of low T, low testosterone. But what it is, the medical term is called andropause. So androgens are hormones that our testicles produce to make us men. In utero, when you're in the belly, the mother's belly, in the uterus, the hormone that differentiates between a man and a woman, or what that fetus will become, is testosterone. When testosterone is produced, we differentiate into a man. So we get a penis, we get a prostate, versus a uterus and ovaries. So it's completely different. That's what happens in utero. So what happens as you get older, usually in your late 30s, 40s, 50s, 60s on up, when those hormone levels drop, basically we become, in a simple word, more feminized because we don't have all the testosterone that we had when we were going through puberty on up. And what this talk about is it's a change in life. You know, women, it's well known what happens to women when their ovaries stop functioning. They go through, I'm going to make this interactive. What does a woman go through? Menopause. We all know it, right? We all know they go through that. And what happens? Number one, they stop having menstruation. They stop having periods every month, right? So the ovaries are just not producing the estrogen and the progesterone that they did in the past. So essentially, they stop having a period, and a lot of different degenerative things happen when a woman goes through menopause. How are you? In a man, we have the same thing. I know it's hard to believe, but what happens is that our testicles or our brain shuts down on the production of testosterone. So a guy who's 25 years old, if you drew his blood work right now, he would normally have a testosterone level of about, say, 700 to 1,000. Once you get in your mid-40s, 50s, early 50s, we draw that level right now on you, most men are going to have a level around 300 to 400. That's the change. The change is a reduction in the amount of testosterone that your body produced. What do you think is the main reason why those levels go down? Why does it go down? What do we experience every day in our lives? Stress. There you go. Stress is one of the big things. What about the food that we eat? Diet. You know, obviously if you have a, it gets better. I'm going to ask everyone if you can silence your phone. Just for I'm going to keep you guys engaged for about an hour, and then we're going to get you going. So what I'm going to talk about is what happens to us men as we age. And it happens to all of us. Some people a little later than others, but it happens to all of us. Okay? So I'm going to tell you what is male menopause or andropause. I'm going to talk about the hormones that are produced and when they go down, why we age. I'm going to talk about the benefits of testosterone. And it's not only for sex. We all think of testosterone as a sex booster. That's only one advantage of testosterone, having a good level. And I'm going to get into more. But testosterone is important for the heart. It's important for the brain, for your function of the brain. And I'm going to talk a little bit about heart disease, the nation's #1 killer, and why men are at bigger risk of getting heart disease, heart attacks, strokes, kidney failure, you name it, because of contributing factors, including low T. And then I'm going to talk about how you can replace your testosterone. Natural ways of replacing it, as well as different pharmaceuticals that you can use. Any questions before I begin? This is an open dialogue. I want you to stop me anytime you feel you don't understand something, because for me, it's more important that you leave here with some nuts and bolts that you will remember. And at the end of the presentation, I do have some questions that I'm going to ask you. And if you get it right, I'm going to give out some freebies. So pay attention, and you will leave out of here with a nice little gift. Okay. Any questions? Don't be shy. Okay. All right. So the androgens, andro, are hormones that define masculinity, that makes us men. And so I talked about this earlier, but during puberty, that's when testosterone levels go up and we become a man. A 12-year-old boy, all of a sudden his voice will deepen. He'll start having body odor. He'll get axillary, armpit hair. He'll get pubic hair. That transformation into a manhood. Before that, if you check an 8-year-old's testosterone level, it's not going to be very high. It's going to be at a smoldering level. But when the brain decides, you're old enough now, let me put out some hormones that's going to stimulate the testicle to get bigger in size, the penis to get bigger in size, for you to start getting what we call anarchy and hair. So anarchy is when you actually start producing hair under your arm, on your chest, in your groin area, in your pubis area. And your muscular structure changes. An 8-year-old versus a 15-year-old, you see the definition, you see the difference. That all occurs because of this increased level of androgens, of testosterone that comes in our bodies. So it peaks at a certain time, and then it starts going downhill. And what do you think we get when the testosterone level starts going down in our blood? One answer. What happens to us physically? What happens to our physical body?
Get weaker.
You get weaker. Okay, so you're not as strong. Other things?
Decrease energy.
Decrease energy, absolutely. Other things? I can show you a picture of a 50-year-old man and a 20-year-old boy, and you'll be able to tell me. So just think of that.
Hair loss.
Yeah, hair loss is one of them. Actually, hair loss does happen because testosterone gets converted over to DHT when you get older, and DHT is what's responsible for male pattern baldness. So that's one of the things. But what's obvious? What happens to your belly?
Weight gain.
Weight gain. I mean, that's huge. Right? You can't eat the same amount of food you could when you were 25. You eat the same amount and you're not burning it. You're going to get a belly. You're going to get what we call abdominal obesity. And that's what stores all that estrogen. And we don't want estrogen. You have too much estrogen, you start crying at movies, you start telling your wife, you know, I can't believe you did that, honey. You know, I mean, there's changes, things happen. So you want to keep that estrogen level down, okay? All right. So let's go back to the basics again. So the brain is a master gland. It tells every other tissue what to do. It produces two hormones that you should remember this. There's two of them, LH and FSH. Just remember the letters, okay? LH comes from the brain and stimulates the testicle to make testosterone. So more testosterone comes out. So when you're exercising, the brain is telling the testicles, put out testosterone. When you're lifting weights, it's telling the brain, the testicles, to put out testosterone. That's when you need it most. Testosterone builds muscle, okay? And it burns fat. The other time, the other hormone is the FSH. It stimulates the testicles again to produce sperm. This is how we become virile, and we can impregnate a woman and give her a baby without sperm. If you're 8 years old or 10 years old and you're not producing sperm, you obviously can't get anybody pregnant. So you got to go through this whole process of puberty before you can start producing good sperm cells. Usually at the age of about 14, 15 is when it starts. So testosterone is made in the testicles, and it has many functions that you're going to learn about today, including sexual function. Now, estrogen is the female hormone. But if we didn't have any estrogen in our body, we would be so crass. We're crass enough. But we need a little bit to have that emotionality, a little bit of emotionality. And so we can actually understand our wives and our children. Because if you just have testosterone, you just have a rage. You just have a rage all the time. So you need a little bit. We have a little, but what happens as you get older and your body fat increases, testosterone gets converted in the fat to estrogen. And that's why you'll see a lot of men, you know, as they get older, they'll grow man boobs, because estrogen stimulates the breast tissue. Now, who here wants man boobs? You know, the boobs may look good on a woman, but you don't want no titties now, right? So you want to keep that estrogen down for that reason as well. So, you know, you go to the gym and you see some guys, they take off their shirt, you're like, oh my God. You know, but what I'm saying is that's what happens. So you understand, you see another guy with man boobs, you're going to say, man, his estrogen is high. You're going to know. So you need to get some zinc, man, to change that. And I'll tell you how you lower the estrogen. But so 5% of the testosterone that's made is going to go to form this dihydrotestosterone. DHT. The DHT is what's going to be responsible for balding, but it's actually a more potent testosterone in terms of building muscle. So only 5%, the body will change 5% of the testosterone over to this DHT. It's 2 to 3 times greater in terms of its strength than regular testosterone, but it contributes to the baldness, as I've said. And it also contributes to getting up in the middle of the night to use the bathroom 1 or 2 times. DHT and estrogen causes prostate swelling. It happens to every man. As you get older, you will be getting up in the middle of the night because those hormonal changes are occurring in your late 40s, your 50s, your 60s, your 70s. Your prostate swell. Prostate cancer is the #1 cancer for men. Did you know that? Yes. You knew that, right? Not lung cancer, prostate cancer. But lung cancer is the #1 cancer that men die of. Because prostate cancer, you can have it for 15, 20 years because it's a smoldering cancer. It's not an aggressive cancer typically. The younger you are, you get prostate cancer, is the more aggressive it is. But if you get it in your 70s and 80s, it's a smoldering, slow-growing tumor. So I know a lot of us worry about prostate cancer, but DHT is the culprit and estrogen is the culprit, not testosterone. Repeat, DHT and estrogen is the culprit that causes the swelling of the prostate, which can then get converted over into prostate cancer, not testosterone. All right, now you're all going to be science majors for just 5 minutes, okay? I need you to see if you can understand what I'm talking about. Is anybody here on a statin? That's a drug, a statin for cholesterol. Anybody here on that? Okay. Anybody else? It's the most prescribed drug in the United States of America. Anybody ever heard of Lipitor? Prevacol? Those? Lovastatin? Those drugs what they do is lower cholesterol. But when you lower cholesterol, this is LDL cholesterol, you lower all your hormones as well. That's why I don't prescribe statins. You're going to lower, if you're a female, their progesterone, which is the red over there. You're going to lower DHEA, which is the precursor to testosterone, DHT, and estrogen. So when you're lowering cholesterol with a statin, it's so potent that most people will develop, if it's a woman, they'll develop menstrual irregularities. They will develop muscle weakness because statins do that. And men will develop particularly muscle weakness and fatigue, as well as you can have liver abnormalities with it. But I showed you this slide to let you know that cholesterol is not a bad thing. It's not, you know, the pharmaceutical industry have told people that it's bad. You don't want it to be 300, 400, but there's other ways, lifestyle ways, of lowering your cholesterol naturally, and natural herbs that can do it naturally without you having to run the risk of taking a statin. Okay? So I don't prescribe them at all, unless they're like 400 or 500, which is very rare. Most people are about between 200 and 300, and you can get that down with normal lifestyle and nutraceuticals. Okay, so now you're over 40. What happens when you're over 40? That happens. I put it in blue because it's called sarcopenia. You're not as active anymore, most men, but there should be. I will tell you that if you maintain the same level of activity you did when you were in your 20s, this wouldn't develop. But for most, you know, we go to work, we come home, we don't want to go to the gym, you don't want to exercise, you don't want to do, so you're going to develop this. This is what you call abdominal adiposity. This is what contributes to diabetes, high blood pressure, high cholesterol, and erectile dysfunction. So your testosterone goes down, you get shrinkage of the muscle, you're not as defined, you get frail, you have a feeling of loss of well-being, you just don't feel that pep that you had. Depression can set in, some people do, they get grumpy, anxious, they get impotence where their desire is not there, the loss of desire, and then erectile dysfunction. That's two separate things, okay? You can want to have sex and see a nice woman, your wife, for instance, and want to have sex, but you have the desire, but you can't maintain an erection. When you can't maintain an erection, that's what you call erectile dysfunction. Or if you have premature ejaculation, that's what you call erectile dysfunction, okay? So you get in your middle 40s, your 50s, and you say, well, I'm just getting old, and you just accept it. Well, the baby boomers are saying different. We're not accepting it, right? So this is why now you'll see all this testosterone commercials, you know, you have it, you can put it under your arm, you can get it injected, you can get pellets, you can do creams and gels, because people don't want to age that way. They want to have vigor. Who here wants to have vigor well into their 90s? Right? Okay, so I'm going to show you how you can do it. Okay, I talked about how this is so andropause is less sudden than females. You know, females get hot flashes. You know they're symptomatic. Hot flashes, night sweats, anxiety, dryness. And I mean dryness everywhere, if you know what I mean. Hair loss. They'll lose their hair, you know, and then they may kick you out. So you just got to make sure that you're being nice to them at certain periods when they're going through it. But it's just as severe. Andropause is just as severe, and it increases the aging of the heart. The heart is not as strong when you have low T. The brain. Remember when you were sharp? You know, you can remember everything. Mental agility declines with low T. A loss of drive and competitive edge. Yeah, I can beat you. When you're ready, you want to take me on? you want to play some ball, you know, whatever. I mean, you lose that competitive edge. You're like, okay, yeah, all right, I'm all right. Increased stiffness, your joints, you know, you have more pain in your joints, you get more stiff, you can't bend down. How many people here can bend down and touch their toes without bending their knees? Okay, stand up. Let's see you do it. Stand up. I want to see it. I want to see it. There you go. Flexibility, my man.
I was at some of the days off cheek a little bit.
Can you do that? All right, that's good. You're the young man here, man. The young man is like, you're bending your knees, B. But anyway, as you get old, and when you lose your T, you become more stiff. That was my thing. So basically, now it's well recognized that andropause, or low T, it's not just getting old. It's a deficiency state. You're losing something that the body needs. You know, don't just sit back and accept it and say, I don't really need to replace my hormones when they decline. What causes aging? Does aging cause the decline of a hormone, or does the decline of the hormones cause you to age? So as an anti-aging specialist, I'll tell you that it's the declining of the hormones that make you age. And you can maintain your vigor, not that you're going to stop the aging process, but you can maintain your vigor and look good well into your 90s and still function the way you should. So I mentioned this earlier, that men between 50 and 70 will have a testosterone somewhere around 300, and usually a guy between 20 and 40, and I'm pushing the 40, would be between 700 and 1100. And the normal levels that's reported on the lab is between 300 and 1200. But most men are symptomatic when this number drops below 500. So I usually start replacing my men when they drop below 500. Okay? Any questions? If you yawn, I'll call on you. Oh, by the way, this is resveratrol. It has very good antioxidants that increases the circulation. And the Italians, when you look at people who live the longest, Italy. And that's because they have a glass of red wine practically every day. So I'm not a big pusher of alcohol, but there are certain things that are good for you. All right, so andropause, it's lethal. When your testosterone drops, yes?
Can you go back one slide?
What's your question, sir?
The number you have, the 300?
300 to 1200.
The under 300 and the 700 to 1100, is that because of the aging or because of not taking care of yourself?
Because, good point. It's because, you know, a lot of people, as they get older, because I have men right now who are in their, I have one guy in particular, and they come out because they're so rare. One guy who's 58 years old, and he has a testosterone level of almost 800. And he's on nothing. But this is a guy who goes to the gym, he eats organic foods, fruits and vegetables, and he looks good. And his testosterone level is 800. But most men don't do that. Most of us don't do that. When we get older, we don't spend time taking care of ourselves the way we should. We don't, I mean, exercise, it's almost like, they're like, oh no, I don't have time for that. They put it on the back burner as though it's something that's optional. It's not optional. Just like you get up and you eat every day, you should be exercising every day for at least 30 minutes to an hour. That's all. It's not, you know, you have 24 hours in that day. You give yourself 30 minutes to an hour to take care of your body, because the body needs it. And what happens is, as people get older, the amount of exercise go down. They don't think it's as important. And I see hundreds of people, I see at least 100 people a week. And this is something that we have to tell people, this is your lifestyle. 90% of what we treat in our office every day is related to lifestyle, which has to do with what you put in your body, your nutrition, the lack of exercise, because that's what it usually is, and then how we manage our stress. We don't manage it right. You know, we let the stress in. Stress causes cortisol levels to go up, causes sugar cravings, causes you to retain salt, causes you to get fat. So it's all, if you manage those three things, nutrition, exercise, and stress, you can have an 800 testosterone when you're 58 or more. So yeah, I can tell you that I have a few patients who, whose level did not drop, but most of my guys in their 50s develop low T. Most of them. Okay, so what I was saying here is that andropause is lethal. So, you know, you have an increased risk of diabetes with it because of the weight gain, brain dysfunction, heart disease, fragility syndrome. That means you become more fragile. Your bone density goes down. So now you're going to be at risk for falling and breaking a bone. Before, with your testosterone level being high, your bone is so strong. But now you can break a bone. And your immune system goes down, so you have an increased risk of cancer. Okay? In 2006, what we found is that men with low T had an 88% increased risk of death. 88%. This was published in my journal, the Archives of Internal Medicine. That's one of the big journals for internal medicine, in August of 2006. So
Low would mean 300 or below?
Low would be, for me, 500 and below. Yeah, 500 and below. Because you start becoming symptomatic when it drops below 500. Some type of symptoms you're going to have. If it's erectile dysfunction or a low energy or something, you're going to have something. So andropause, usually early 50s is when it starts, right? But it happens earlier if you do any of these other things. If you're overweight, if you smoke, if you have diabetes or high blood pressure, you will develop it in your 40s. So now you go there to your doctor, and you're like, Doc, I don't have any energy, I'm feeling kind of down, you know. So he said, I think you're depressed. Here. Here's an antidepressant. And so a lot of stuff that they give you, you know, they give you stuff because they're treating symptoms. They're not looking at the root cause. And that's how most allopathic physicians, I am an MD. I'm not an alternative doctor, I'm an MD. But I made a transition 12 years ago when I became certified in integrative and anti-aging medicine. And I now use lifestyle as my mainstay of treatment for everything. For everything. I'm not just going to come in and you have high blood pressure and I just give you a blood pressure pill and send you. I said, listen, you have high blood pressure, you know why? You have too much stress, you're overweight, and you're eating wrong. Do you want to be on this pill? Because the next time you come back in 3 months, I'm going to give you another pill. Change what you're doing now. When you develop a disease, the body is telling you, you're doing something wrong. So change it. You understand what I'm saying? So we can change it through lifestyle. Eating, nutrition, exercise, and managing our stress. I'm not going to spend any much more time on estrogen. We know it's not good for us. We just want a little bit of it. There's a natural herb that God put on earth called nettle root and saw palmetto that will help to block the effects of estrogen on the prostate and in preventing testosterone from turning into dihydrotestosterone, which I tell you, when you have that, it could cause prostate swelling and male pattern baldness. So those are natural things. No side effects. Okay? So all these things happen when you have high estrogen. You need a little bit, but you don't want it to be over 30. So if your doctor tells you that your estrogen is 50, you know you're going to have some of the side effects. Let me tell you what you should look for. Look for man boobs. Talked about that. Look for prostate getting up in the middle of the night. Once, twice, to urinate. Those are distinct signs. Look for increased irritability. You know, you get upset easily, you know. Look for low energy. All those things. So testosterone now is not just for sex. You have more testosterone receptors in your brain and in your heart than you have in your scrotum. That's how important it is. This is what I told you in utero what happens, that's what defines us. So you have a lot of receptors. So when you have a good level of testosterone, this is what's going to happen. You're going to have increased muscle mass, improve oxygen uptake, controls your blood sugar, it regulates your cholesterol, and it makes your immune system strong. So you can fight off infections. It's important for your bone density, makes your bones strong. It's important for red blood cell production. Matter of fact, this is one of the cautions when you're on testosterone therapy. Your blood count can go up too high, so it has to be monitored. It has to be monitored because you can have a normal hemoglobin is about 15 to 17. If it goes up to 18, 19, or 20, then your blood is too rich. So you want to make sure you're not overdosing on your testosterone, so it has to be monitored. If you go to a doctor and he just puts you on testosterone, doesn't check your level, and don't tell you that it needs to be monitored, he doesn't know what he's doing. It has to be monitored. You have to get your levels checked, at least twice a year. So now, are you convinced? You just got here. Are you convinced that you need testosterone?
Yeah.
You need it, right? Yes, sir.
Let me ask a clarifier on the receptors in the brain. So if you kind of feel cloudy in your thought, not able to articulate statements,
Memory loss.
Memory loss. Mm-hmm. Is that a sign of the low testosterone?
Yes, it is. It is. It is a sign. It's not necessarily him. He's talking about his cousin. It's his cousin who has. Oh, we're talking about you. Yeah. So, yeah. So really, that's. Any other questions? Yes, sir.
So what would you say, like, going into GNC, if you, like, they have a lot of
testosterone boosters?
Yeah.
Yeah.
As opposed to going to your physician and getting a recommendation from him, would it be beneficial to go to your physician as opposed to going to GNC and just get some off the shelf?
Yeah, I think everybody, if you're taking any of those nutraceuticals, you need to at least get a baseline. Find out where you are, you know? Every doctor, if you go to a good primary care doctor, will get you a level. They will do the panel of blood work that you need. They'll check your estrogen. They'll check your testosterone. They'll check your DHEA, that other hormone that I told you about. And DHEA you can get over the counter. You probably will see that in GNC or any other herb shop. We sell it over the counter here too, because it goes on to form estrogen and testosterone. So you should never take DHEA though without taking zinc or some blocker of estrogen formation, because when the DHEA is there, you don't know which way it's going to go. It can go to form estrogen, it can go to form testosterone. So you want to make sure by blocking that reaction. So zinc is a natural aromatase blocker. Chrysin is another one that blocks it. And there's a drug called anastrozole that we put, most men that I put pellets in. And I'll get into the treatment in a minute.
Another question.
Yes.
We're starting to hear more and more through the
Press.
news press side effects to testosterone treatment. Can you speak on that at all?
Yeah, sure. I'm glad you asked. JAMA came out with a study earlier on this year saying that they had men who they put on testosterone injections. They were on testosterone injections, and they had a slight increase in mortality. These men, when you go back and you look at the studies, were very sick. They were sick people. They never monitored their levels at all. And they just gave them a prescription, told them to go and do 2 shots a week. And then they monitored that. And they went back, and this was a retrospective study. Retrospective means that you put people on testosterone, and then you go back and say, okay, these people died. Let's see if they were on testosterone or not. So it's not like it was a prospective study where you got a control group and you followed them through. It was going back and looking at data and said, okay, these people died, and they noticed that these people were on testosterone shots. So it's not a very good study, number one. We have over 500 studies that prove the benefits of testosterone. So it's all about the lawyers. I mean, now, everybody's jumping all over it because they say, have you ever been on testosterone? You know, you should, in this government, and this, we want to sue and we want to do stuff. But believe me, there is no harm. If you're monitoring your testosterone level, there is no harm in being on a natural substance that your body made. To me, it kind of makes no sense for them to say that this thing is harmful when you made it. This is something you made from the time you were in utero on up. And all of a sudden now it's toxic for you? No, it doesn't make sense.
Do you recommend taking the saw palmetto and the mellow root in conjunction with the...
Absolutely. Absolutely. Saw palmetto, everyone should be on saw palmetto if you hit 50 because your prostate will swell. And saw palmetto will prevent testosterone conversion over into DHT. And it's an antioxidant for the prostate, and it will prevent that swelling. You'll be able to sleep throughout the night, or you won't develop that dribbling that most men will develop as it gets bigger, okay? This is something that's very, very important. Saw palmetto, and it's a natural. They have drugs. They have Flomax. They have other drug, Proscar. Yeah, there you go. You have another doctor in the room. So, so he could tell you all the drugs that they have for that. But I rarely use those drugs again. I prefer to use the natural ingredients to help the body to work better. Okay, without side effects. Yeah.
He asked a question. I'm just curious about the testosterone. It comes in various forms. I know it's either you rub it on or you inject it.
Yes, sir.
The type that's topical, is there some danger for other members in the house? I remember hearing when I heard this whole commercial once, it said, you know, gave the disclaimer at the end, and one of the disclaimers said something about be careful about other people touching you.
Yeah.
It said it's in another format, but be careful about other people touching you.
Yeah, that's why normally when somebody's on a cream or a gel, you tell them to put it on in the morning after their shower. Rub it in for a good minute. No, it's not like you're putting lotion on, you know. You want to rub it in, and usually I tell them to put it on their thighs or in their butt, and they rub it. So by nighttime, it's gone. It's already absorbed. You know, it's actually absorbed within a couple of hours. But yeah, you wouldn't want your little 2-year-old, you know, rubbing on you and getting a little mustache or going here. So, you know, that would not be fun. That was like, what's going on?
The placing it down here makes it probably less dangerous.
Yeah,
I just saw a commercial when they put it under here.
Well, yeah, that's a new. Yeah. Let me just say about these drug testosterone that they come, you know, they have to change it because they can't patent a natural substance. So they have to either patent the delivery system, like the axillary one, or they patent the carrier molecule, like in injections. They add a cypionate or a decanate to it, so they can patent it. And once they get it patented, they can charge hundreds of dollars. But a natural bioidentical testosterone cream or gel that you get in a compounding pharmacy will cost you about $50 a month. If you have insurance and you get the injections, you probably won't have to pay your copay, which is probably anywhere from $30 to $50 to $60 or whatever. But the actual cost of that your insurance company is paying is about $300. So it's that much more expensive. That underarm cream, that's $300, $350 for that underarm cream. But versus if you go to compounding where you're getting it from wild yam, it's chemically converted over to the natural testosterone product, it's much better for you, and it's a whole lot easier on your pocket. So I use bioidentical testosterone, and I use that through a compounding pharmacy. I don't write prescriptions for it to go to Walgreens for you to get that. That's way too much money, and it's not in its natural form. There's something different about it. That's why they can sell it that way.
Okay, I was just thinking about this is probably more dangerous here as far as passing somebody. What you just said on your arms?
Possibly, but I don't know who's going to go up under your arms. Oh, I see. You're hugging them like this. I got it. My bad.
Everybody's short.
My bad. All right. Okay, so let me go in here. So testosterone on libido, it helps your libido, for sure. So it promotes desire, right? So once you use it, a lot of people will confuse it. If they have diabetes, for instance, or they have high blood pressure or high cholesterol, and their circulation is poor, and they take the testosterone, I've put pellets in people. They came in, their levels was 150. I put pellets in them. They come back a month later and said, "Doc, I don't feel nothing." I'm like, "What do you mean you don't feel nothing?" He's like, "No, I don't feel anything. I couldn't get it up. I couldn't get it up." And I'm like, "Okay, well, let's check your blood." Blood work comes back 900. I said, "Well, so do you have the desire?" "Oh yeah, I want to do it, I just can't do it." That's two very different things. That's why I made the distinction between erectile dysfunction, which is a circulatory issue, versus a desire, okay? It will help, testosterone will help with ED, but it's not the best thing for ED. You need something that's going to dilate the blood vessels. And so things that, like arginine is a natural amino acid that will help to dilate the blood vessels. You want to make sure your blood pressure is under control. If you have sugar diabetes, sugar is in your blood. Your circulation is poor. So you have to use, in combination, what we call a phosphodiesterase inhibitor, things like Viagra and Cialis and Levitra, because those are drugs that helps to increase nitric oxide to open up the blood flow. Your circulation can be so bad that you can never get it fixed. So you have the desire and you still can't perform. So at any rate, that's a little bit on libido. It helps your libido. I talked about that before. Testosterone and mental decline, and you mentioned it before. Low testosterone causes the loss of ability to concentrate. It makes you moody, emotional, great timidity, you feel weak, inner unrest, memory failure, passive attitudes, yeah. That's one of the passivity that comes up. Well, it doesn't matter. Reduce intellectual agility. And this comes from Jonathan Wright, who's an expert on testosterone. And this is a big thing. When you have low T, this thing develops in your brain called beta amyloid. That can contribute to dementia. Everyone knows what dementia is? Yeah, it goes up. You have less of it when your testosterone is higher. I talked about zinc as a natural estrogen blocker. The other two things are chrysin and anastrozole. Now I want to spend the next 5 minutes on the heart, because the heart, what is the #1 reason for death in this country?
Heart disease.
Heart disease. I thought you were going to say it. It was right on the tip of your tongue, I know. You have so much testosterone receptors in the heart. Remember, the heart is a muscle. And testosterone is in peripheral muscles, but it's also packed in the heart. So it opens up the blood vessels of the heart that supplies the heart. It causes vasodilatation. And it maintains a healthy cholesterol level. In China, not in the United States, but in China, they use testosterone for people that have congestive heart failure to give it that extra oomph. So you want to make sure that if you have high blood pressure, or if you have congestive heart failure from long-standing hypertension, that your testosterone level is normal. You want to get it in a normal range.
Why is it not used in the
Why is it not used in the States?
They don't use it. That's not something that they have done. They prefer to sell dobutamine and digitalis and other things like that. Remember, it's a drug mentality. We have a drug mentality. It's not about natural replacement here. That's just, the pharmaceutical industry runs medicine in the United States. We're taught symptoms and drugs. We're not taught about utilizing natural remedies for things. Testosterone is a natural remedy. It's what you made in the past. So that's why. But anyway, just look at this map. You'll see that heart disease is responsible for more deaths than all cancers combined, intentional injuries, chronic lung disease, pneumonia, and diabetes. And AIDS is all the way down here. Heart disease, blockages. Blockages in your brain, blockages in your heart, blockages in your legs, blockages in your kidneys, kidney failure, you would name it. That comes from being obese, high cholesterol, hypertension, sugar diabetes. Bad circulation contributes to that. Cigarette smoking. Anybody here smokes? Okay, nobody's going to admit it, right?
Hey, your discount just one way.
So these are the things that causes us to have heart disease. In men, we get heart disease 10 years sooner than women. Women get heart disease when they go through menopause, after they lose their hormonal effect. Men get heart disease starting in their 40s. And it's because of the fact of how we live. A lot of us smoke, we have high cholesterol, high blood pressure, physical inactivity, we get obese, uncontrolled stress or anger, a diet high in fat, we like those burgers and fries and wings, and we drink too much alcohol. Too much.
Too much. One thing I'd like to just add. During the Vietnam War, a lot of young teenage children that died in the war, when they were given autopsy, was shown that they were having heart disease changes as early as 17 and 18. Even start as young as that. Yeah. So you just have to be aware of that. So heart disease doesn't necessarily start in your 40s and 50s. It starts when you're actually a teenager.
It just takes those decades to build up to where you become symptomatic. But I did have, in residency, I did have a 27-year-old who had a heart attack. So it depends on your genes, and especially when it comes to cholesterol, how your body metabolizes cholesterol. Some of it is genetic, and they do have high levels, 400, 500 levels, that will predispose you to having heart disease.
What about men that smoke herbs?
Herbs. What's herbs? I don't know what that means. You mean marijuana? I'm just kidding. I knew exactly what you meant. But you know, I will tell you that marijuana is probably, they've approved it now for in certain states for medical marijuana, for nausea, for treatment of cancer, for cataracts, and for glaucoma. But when you smoke weed, having one joint is like smoking a full pack of cigarettes. It's not good for you. It's not good for your lungs. I know you don't want to hear that, but I'm sorry, man. I got to tell you, it's loaded with stuff, and it's not good for you to put smoke in your body, period.
But remember, cigarettes go through a chemical. It's a chemical.
And a lot of the marijuana goes through the same chemical too. A lot of the marijuana, they do that. You know, it's the pesticides that they put on it. There's a lot of there's a lot of wrongs with doing it. So anyway, when you get these problems, this is what traditional doctors will use: just drugs, drugs, drugs. Lipitor we talked about, antihypertensive, medicine to lower your blood sugar, medicine to suppress your appetite. Then they put you on blood thinners and anti-inflammatories, all drugs.
So Dr. Christie, if you are on one of those types of drugs and you're doing your testosterone, is it still as effective?
Yeah, well, I would tell you that what you want to do is not just testosterone. I mean, I don't want anybody here to just think that all they have to do now is get on testosterone and every ailment is gone. No way. This is a lifestyle approach. You have to do everything right. You got to do the 3 things that I'm talking about. You got to eat right, you got to exercise, and replace what's missing. So what's missing is testosterone. If that's low, you take it. But I'm not saying that just taking testosterone alone and doing everything you've been doing, you know, you're going to leave out of here, there's a Burger King across the street, you're going to go get a big whatever, and you know, no, it's not going to work. It's a lifestyle, a complete lifestyle change. TLC, total lifestyle change. But yeah, I mean, the testosterone is, being on those drugs don't prevent the testosterone from working. but you're doing everything right, you'll see a dramatic improvement. So now when the drugs don't work, what do? They call the plumber, rotor, and then they do what they call cabbage. You know, everyone know what a cabbage is? Open heart surgery, where they actually go in and cut out the blockages in your heart, and that's a cabbage. Does anyone know what an angioplasty is? Or a stent, where they go in, they open it up, and they put a little stent to keep the vessel open. Then, if it's in your legs, they go in and they cut out the clot, the hardening of the artery. If it's in your neck, they do what they call an endarterectomy. They catheterize you by putting a catheter up into your heart to look at it. All this very expensive intervention, every insurance will pay for it. But you want omega-3 fish oil and you ain't got no money, they're not going to buy it. You're not going to get it. Coenzyme Q10? No, you're not going to get it. You want a multivitamin? You know. But if you're sick and you need your heart open, we will take care of that. With no deductible. You know, this is how crazy it is. Lifestyle is last. Doctors, we don't get paid to sit down and talk to patients about lifestyle changes. We would be in the room. That's why I have the Regen Center. Everybody who comes here have 30 minutes to an hour with me, because I didn't want to do this insurance medicine forever. So I can actually teach my patients what they need to do to get better outcomes. Otherwise, I'm running in the room and I'm saying, oh, you have hypertension, diabetes, high cholesterol? Okay, here's 3 prescriptions and you're gone. I didn't really spend any time with you telling you what you need to do lifestyle-wise to make you a better producer of health. You know, so that's what insurance medicine is all about. But TLC, total lifestyle change, is the foremost. My approach, integrative medicine approach. Stress reduction, nutritional supplementation, and exercise. Mind-body medicine. Yoga for relaxation and for stretching. It's absolutely amazing for that. Massage therapy. Chiropractic adjustments. Why is chiropractic care important? Most MDs poo-poo chiropractic care because they don't understand the benefits of it. Who is in here have a chiropractor? See, maybe what, half? You need to get adjusted. Why? Because you have your brain, you have your spinal cord, and you have all these bones that go down your back, your spine. Any little thing, if I lift something up, I'm moving things that they're shifting. They're getting subluxed. Those bones are not staying straight and properly opposed the whole time. When they move, they press on nerve endings, which prevents the body from healing. The nervous system is regulated through the brain. It's like an extension of the brain. So if your bones are not in alignment, you will never heal properly. Never. So that's that for chiropractic. And there's no chiropractors here, but I have 2 chiropractors that work with me full time. This is how much I believe in it. There's one downstairs and one in my Hateville office. So it's very important. So managing your stress. Real quick on diet. If you want to know how to eat, if you have to chase it, eat it. If it's real easy to get, you probably want to run away from it. The raw the foods, proteins, grilled fish. You want to take off your skin off the animal. You want to eat lean meats if you're going to eat meat, lower in fat. You want to eat plenty of vegetables and fruits and things like garlic that's awesome for your blood pressure and your cholesterol, and onions and kale and nuts and olive oil and pecans and walnuts. These are the foods that the body wants. Nothing on there says Big Mac or French fries or anything. That's what the body needs. Eat like that, guys.
So you can't dip the fries unless
you can bake your fries. You can take the potato is good. Cut it up, bake it. Don't deep fry. Don't, especially in vegetable oil. These things are not too good for you. You want to have coffee, but you don't want to have a lot of coffee. I don't tell people they can't have coffee. Some people do, but I don't.
What's the caffeine? You can explain quickly. Say, minimize stimulants. Assuming you're talking about the caffeine.
Yeah, you want to minimize that.
And that caffeine does it have an effect?
It can raise your blood pressure, right? And it messes with your metabolism in terms of burning fat. Yeah, if you drink too much of it. 1 or 2 cups at the most is all you really need. But some people drink a pot, 2 pots a day, and then that's not good. All right, and the other 2 things that I have highlighted there, sugar and white flour, poison. Poison. This is the reason why most people in this country are obese. 70% of this population is overweight or obese due to those 2 things. Soda, Coca-Cola, all soda beverages, 16 teaspoons of sugar in 1 16-ounce bottles of soda. All the white flour, everything is processed from your pizza to your pasta to your bread. And that goes straight. It raises your insulin level and causes your body to store fat. If you get anything out of here today from the diet, stay away from these 2 things. Sugar and white flour. You'll see the weight come off slowly but surely. Other thing, you want to eat 5 to 6 small meals per day. We're meant to be grazers. We're not meant to sit down and have a big meal at night. And sometimes, you wake up in the morning, you don't want to eat because you're full from the night before. But you have to have breakfast. If you didn't eat a big, gigantic meal at nighttime, you would be hungry in the morning because your metabolism would change. But when you don't eat, and then you come and you eat 2 big meals, a big lunch and a big dinner, you've shut down your metabolism because the body has sensed starvation even though you're fat. You have all this energy, fat is energy by the way, you have all this energy on your body that your body won't burn because you're not feeding it in the right proportions that you should to keep that insulin level and your rate of metabolism normal. So keep your weight down. I'm not going to spend much time on that, but you need to exercise. Very important. You need to do weight training as well as functional training and cardio. 30 minutes a day. Every day if you can. Avoid stress. I'm going to wrap up now by talking about the treatment of andropause. Okay? So this gentleman mentioned before that you have the patch and you have the creams. But did you know about pellets? Does anybody know about testosterone pellets? All right, testosterone pellets are pellets that look like a rice grain, maybe a little bit big, brown rice with the shook still on it, brown rice. It looks like the size of a brown rice grain. And basically we insert the pellets underneath the skin. It's a procedure that takes about 10 minutes to do, and it lasts from about 6 to 8 months. And if you exercise, it lasts longer. So that's one of the things. I put pellets in people and they don't exercise. They feel better, but they don't want, their mindset, they can't find the time for exercise, which is ridiculous. You have to find time. My wife and I used to roll out of bed for 3.5 years. At 4:15, the alarm went off. We were at the gym by 5 o'clock, worked out with a trainer from 5 to 6, got back home around 6:30, either took a nap before we got ready, and then came to work by 8:30. So it can be done. And I'm running 2 practices, now 3. I'm the director of education for a medical school. And I also have a nonprofit that we do mission trips all over the world, Africa and so on. So I'm busy, and if I can find time to exercise, I tell you that you can find time to exercise too. It has to be a priority. I know if I don't exercise, if I go a day or 2 days without exercise, I really start feeling it. And I feel like I can't eat what I want to eat. Because even if you're eating healthy foods, you know, I tend to be a little bit of a glutton. I like eating a lot of food. I'm supposed to eat small meals, but sometimes I eat a little bit too much, and then the way I balance it is by exercising. And if I'm not exercising, I'll start seeing a little bit of weight creeping up, and I said, okay, well, I have to back down. So you got to constantly be monitoring it, because I don't want a belly. If you get a belly, that's where you're going to get all the chronic degenerative diseases come from that belly. You're going to get hypertension, diabetes, high cholesterol, and low T. So I don't want that. All right? All right. So let's finish up. So natural testosterone is identical to the testosterone that's made by your testicles. It's not a synthetic compound. When you buy a drug, most likely it's going to have something synthetic in it. Either the delivery system is synthetic, or it's going to have a cypionate or some other molecule attached to it so that they can patent it to make $1 quadrillion. Okay? These are the different ways that you can have your testosterone. The range is between 20 milligrams to as high as 100 milligrams a day. With the cream, I start with between 25 and 50 milligrams daily, and I always put a aromatase blocker with the cream. So I don't want that testosterone going over to form estrogen. So I use the Christie. So usually the prescription is for 50-25 as a standard dose. And then first I want to check it. I want to check the levels. How are you doing with it? First I talk to you and I find out, are you feeling any better? And then we check the levels. And it's not done in the blood. That's the other thing that traditional doctors do. When you're doing a cream or a gel, that's rubbing into your skin. It's going through your lymphatics and it's going through your saliva. It does not go into the serum and stay in the serum. So when you do a blood test, it's not accurate. You have to do a saliva test when you're doing creams or gels so that you can get the accurate. When you're doing injections or when you're doing pellets, the blood is adequate. But when you're doing a cream or a gel, you need to do a saliva test. And that's out of pocket because it's not covered by insurance. So now the injectables, I told you, these are the things that they add to it, the cypionate and the decanate, so they make it unnatural by adding it so they can patent it. And a lot of urologists, they'll use that, and they'll start out with an injection twice a week, say on Sunday and Wednesday. The problem is that when you get a shot, for the first day, it goes up, and then day 2 it's down, day 3 it's back down, you give another self-shot, it goes, so you're like constantly going like this. Versus a pellet that stays in you and stays this way for 6 to 8 months and until it wears off.
Pellet in your arm or?
No, the pellet is in the thigh, and it's actually towards over here, where it's not in your seat plate, and it's not, so it's kind of like towards the side, so it doesn't interfere with your belt line either. So I've done hundreds of men and women with pellets, and that's my go-to way. I usually start people out on the cream though, or the gel, until I see how their body responds to it. So the dose depends. Now Jackie and I went to Arizona, and the guy who developed the pellets, the procedure, his name is Tutera. He's an Italian guy. We went there for a few days and we learned how to put the pellets in. And you know, they have a website, sotapelli.com. You can see all the research that's been done with the pellets. And we get our pellets locally here from a lab in Atlanta. So it depends on your body weight. If you have diabetes, if you're fat, if you have metabolic syndrome, you're going to need more, because that works against you. We put it in, and each pellet is 200 milligrams, and you'll need anywhere between 6 and 10. They're tiny, like I said. There is a pharmaceutical grade pellet called Testapel. It costs a whole lot more. Just to show you, 200 milligrams of the bioidentical one will cost you $35 a pellet. 100 milligram of the prescription will cost you $85. So if you had 200 milligrams, 85 times 85 is 100 and whatever, $70 for the same thing. That's because they went through the FDA and got approved and did all the studies and everything like that, so they can charge that much more. And insurance, some insurance will cover that. So now that you've got your pellets in or you got your cream, what do you expect? You expect improvement in your erectile function, cognitive function, and mood. You could expect improved blood flow to your brain, reduce your dementia, if you have any, reduce heart disease, reduce inflammation in the body, reduce prostate cancer, improve exercise capacity, and improve your strength. I want it. I'll talk about this, but now I have 5 questions. That's us. We have three locations. All right. The first one, there's no gift for this one. That's too easy. True, false. I'm going to pick on somebody, okay? Somebody who hasn't spoken all day. This gentleman here. Can testosterone cause prostate cancer? Yes or no? Were you here?
Yeah.
Okay. No. Does anybody say anything otherwise?
We said low testosterone determines estrogen, right?
Yeah? Low testosterone.
Yeah, lack of testosterone.
Yeah, right. But so this is, I wanted this point clear. Testosterone does not cause prostate cancer. Okay? It does not. If you have prostate cancer, they will not put you on testosterone because testosterone is anabolic. It builds you up. So they don't want, they believe that it may help it to grow, but it does not cause it. The causative agent, again, is estrogen and DHT. Those, not testosterone. And I kind of said it a few times. But you got it right. No points for that one. Let's get into something. Let's get into something where you're going to get a point. Okay. I have some freebies. All right. Let me see which one I should do first. All right. This is the wonder drug here. No sneakers. DHEA. What is DHEA? I talked about, nobody's listening to me. What is DHEA? Dihydroepiandrosterone, but I don't expect you to remember that. But I do want you to understand that it makes what? What does it turn into? Testosterone, right? And estrogen. So if you take this, what else do you have to take to make sure it doesn't turn into zinc? All right, somebody who's listening. Okay, so what can testosterone change to? I just said it. Estrogen and DHT. All right. You told him the answer? Get your zinc. You don't need your zinc with that. All right, next. All right, now I have saw palmetto. Saw palmetto. I'll tell you about it again in case you don't remember. But who's going to answer this one? Who wants to answer? You want to answer? Okay, this question is for my man over here. He's my patient already, so he knows me. What is the natural aromatase blocker? What blocks the formation from testosterone to estrogen? That's what I'm asking. What does that? What blocks it? Testosterone from going into, it's called an aromatase blocker. What is a natural aromatase blocker?
It's in your hand.
No? Yeah, what blocks it from becoming estrogen, guys? I showed you a slide on that. All right, nobody gonna get this one.
Let us start with the statins.
We have already even talked about it just a little while ago. So nobody got that one. I am not giving this away. You got to earn this. You're going to have to earn it. Okay, next question. Hi. Okay, let me tell you what that does. That's the saw palmetto. That shrinks the prostate should you have prostate swelling because it blocks DHT. All right, so saw palmetto prevents DHT formation, and it's an antioxidant for the prostate. Okay? Did everybody get that? Yeah. All right. And then the last. All right, now, this is our vitamin, and it has our logo on it called N1 Wellness Active Man Vitamin. It has everything in it that you would need as a man. And I can't read it because I have bad eyesight, but I know what's in it, so I don't have to read it. I have, you know, when you're over 50, your eyesight goes, your reading eyesight goes. What's that? What you said?
Now we give him something.
Oh, Active Man? Yeah, yeah. The Active Man has got everything you need. You know, if you're going to take any one thing, this is what you have. Because it has the saw palmetto in it. It has zinc in it. It has all your B's for energy. It has the A's. It has the C. And so it's really, that's why we call it Active Man. You got good eyesight? Yeah. Just kind of read the herbs for me because I can't read that right now.
Maca.
Maca. So, yeah, those two promote testosterone elevation. Maca and tributus. Go ahead.
Marapuma.
Marapuma, the same thing.
Colostrum.
Colostrum improves your immune system.
Panax ginseng.
Ginseng improves your energy.
Green tea.
Green tea helps with weight loss.
Saw palmetto.
Yeah, we said that. We know what that does, right?
Mm-hmm.
Okay.
Pygeum.
Pygeum enhances the effect of saw palmetto.
Lycopene.
Lycopene is good for your prostate. It's in tomatoes, so that's why they tell you if you have prostate issues to eat tomatoes.
Polycasanol.
Polycasanol reduces your cholesterol level. That's enough. That's enough.
It's getting even tougher.
Improves your immune system. Yeah, there's colostrum. Yeah, but you know, they bottle that now. You know, it's bottled. So this is the Active Man formula. All right?
Question about Christie. If you're taking the Active Man, do you need to take saw palmetto?
I tell them yes, because the saw palmetto is give you a higher milligram amount. This has trace of everything in it. So if you like, you know, it's good. You can start taking this at the age of 20, 21, you know, versus if you're over 50, you should take additional saw palmetto and additional zinc. You should. Okay. So who's going to be my A student and tell me what supplements promote a healthy testosterone level? And you have to name at least two. Somebody who's... When you say it, I want you to just stand up and... You've just listened to an hour of boring lecture. I tried not to be boring. I was trying not to be boring, but come on, tell me. What supplements will promote a healthy testosterone level?
DHEA.
Right?
Zinc. Palmetto and Active Men.
I'm guessing, listen, we're selling these to, it's $25. You're not getting it. Nobody, these are $25 for them, but today and today only, we're selling them for $20, okay? So you can get your Active Man today, and you who would have gotten that answer, that's all I wanted you to say. You would have gotten your free bottle. But nobody got up and said it, and so that's it. Now I'm available for questions, and the girls back there, they'll be selling these, so get your bottle before you go. If you want what you call an appointment, just check with them.